we're advocating for us to be spent in the county in a way that that benefited our local businesses. We expected to hear about housing. We expected to hear about roads. We expected to hear about broadband and things like that. And immediately the discussion went to childcare. And these were from employers that were struggling to find employees because they couldn't find childcare, struggling to keep employees because of childcare, employees missing work because of childcare. So we felt we needed to gather some important people that knew that industry. So we gathered a group together to start talking about that and really realized what a crisis we were really in. That people were talking about a little bit, but nobody knew what to do about it. And I'm not saying we necessarily have all the answers of what to do about it either, but we're taking some baby steps. We applied for some big grant money, workforce innovation grant money, which would have been millions of dollars. But it really got our group together and very focused on what some of the solutions might be. We didn't get that grant, but at the same time, we applied for a Dream Up grant through the Department of Children and Family Services. Not quite in the millions, only $75,000, but we were awarded that grant as a community to try to put together a strategic plan to address the childcare capacity issues that we have. So that's where this conversation is. We're about a year later, and we're in the, we finished the strategic planning, working with consultants, and now we're implementing those plans. And one of the things that really is driving that is this survey. A lot of information. We are very pleased. So Dean will share all of that, but I just want to let you know there are 4 initiatives that we are addressing as part of that grant. But I have multiple team members. Some are here, some are working on other of the initiatives, but I'll point out the ones that are here. Karen Nichols from the Chamber, Julie Grossman from the Y, Kim Rooney, United One, Ashley Bender from United Way. But also involved, we have both Aurora Hospital and Holy Family representation, Wisconsin Foundry, some of the school districts, Family Connections, which is the Childcare Resource and Referral Agency that covers both Sheboygan and Manitowoc. We have the owner of Precious Memories Daycare, so we have other providers besides the Y. Colleen from Lakeshore CAP is also a part of this team. Michelle Zautner from Lakeshore Technical College. And that's about it. So at the end of this, if you're interested in helping us with some of these things, there's a sign-up sheet over in the front, so please mention that. But the 4 initiatives that this group is working on through this grant, one is to increase enrollment in the early childhood education programming at LTC. Really at the root of this capacity issue is that there aren't enough childcare workers in the childcare industry. Isn't that there aren't enough childcare spots? There aren't that either, but there aren't enough workers to be able to fill those spots. So we are looking to get higher enrollment at LTC, offering some scholarships and things like that in that programming. We're also looking to engage unregulated or entrepreneurially minded providers or potential providers to start a daycare, start a childcare business, whether that's a center or in-home care. We're also looking at expanding in-home care. The 3rd initiative is to provide facilitated professional development workshops and a space for peer-to-peer conversation for childcare providers. They really don't have a good support system, so we're looking to create that support system for them. And then the final one, which a lot of the data from this survey will hopefully help this conversation, but we're looking to establish an operational model pilot program in which local employers partner with childcare providers to offer childcare as an employee benefit, paying a portion of that childcare cost. That would be a game changer, and that's going to be a big leap. But I think as you hear Dean talk about some of the results of this survey, you'll see why that really does make sense for employers to take that into consideration as they look to retain and recruit new employees. So the purpose of this survey was to get current data that assesses the needs of our local families and to what degree these childcare challenges really affect their ability to participate in the workforce. So like I said, we're very pleased with the results, although that doesn't sound right to say that we're pleased to hear that we have a childcare crisis. That's not what I mean. We wish we didn't have to have this conversation at all, but it really, the level of participation was great. And the data is really providing us the tools that we can develop some programming moving forward and hopefully alleviate this crisis over time. So with that, I'm going to introduce Dean Helverson from Lead Research. If you haven't heard of Lead Research, they are headquartered in Manitowoc, have offices in Minneapolis, and 40 years of research experience working with some of the biggest brands in the nation. So they've been dedicated to community support through all those years and have helped many of our local organizations, including major discussions as part of Vision 2011 and Vision 2022. So with that, Dean, I'll turn it over to you.
Good evening, everyone. This will be interesting. I don't think we're gonna knock anyone off their chair here tonight with what we found. I think what you're gonna find is things we already knew, but it's kind of like if you ever put a big puzzle together and you dump all the pieces on the table and you look at a piece and you go, oh, I don't know if I understand this piece, but when you put it together, you get a picture that fits. That's really what this data did. It shared a lot of things that I think we all probably suspected. It put them together in a way that demonstrates we have some issues here, issues that are impacting our workforce at a time when workforce is critically important if we're going to keep growing as a community. And also in the way it shows the resiliency of families. And I think that's something we've known about this community forever. I'm fortunate to be able to be born and raised here and spent my whole career here and was able to find a career that I could reach out across the country and across the world and still be in the place I love. And what I see here is the heart and soul of this community of families working together to take care of each other and addressing needs. And that comes out very strongly in this. So now we got to figure out what's the next step. Next slide. So we put this together with the 4 organizations. Lakeshore CAP provided funding because the direct grant didn't allow specifically for research as part of the grant process. So Lakeshore CAP stepped up and helped us with that. CHA for Broadcasting was fabulous in this process. They brought a lot of our prize package content together, and they also did a lot of promotion for us to help us get people to complete the study. We talked about being a goal of understanding childcare needs of families and how those connected with workforce. I was kind of surprised when we started the discussion. This isn't a new subject. They've been talking about it everywhere. And yet I really struggled to find a questionnaire. My thought was, we can go online and find a questionnaire that somebody in the Valley did, Milwaukee did, Madison did. I found a lot of child care studies, but I found very little, if anything, that tied childcare to workforce. And I think what we have here is somewhat unique. We've already had some interest from outside communities in this because of that connection. And when you analyze the data, it really shows how these two issues connect. They are not separate issues. They're ingrained issues to each other, and one is impacting the other. And so now that we can identify that fairly specifically, the next step is, what do we do about it? And, you know, we've been talking a little bit since we've seen the study, and this is not an easy item to fix. If it was easy, it'd be fixed already. So we're going to have to roll up our sleeves and see what we can do. We had 654 completed interviews, which is a very solid sample. That is both families and people who provide secondary care for a child under the age of 18. The vast majority are the family group, but we wanted to talk to some of those care providers also so that we understood their situation. We did all programming and posting. We brought survey completions in from our local panel, from contacts that the 4 organizations had, through some media publications, so it's kind of multi-source. And we'll jump right in. So at a 40,000 foot view, kind of 5 things stand out to us. The first is family is the focal point of childcare in Manitowoc County. It is the primary source of care. It is the secondary source of care. And that shows the strength of families in our community. It also poses a bit of an issue. If you're an employer trying to recruit me, especially a young person, into the community, and I don't have family here, that breaks down very quickly. And one of the things we're going to have to address if we're going to be successful in recruiting is how do we take those young people who want to come here and start a family and create that structure for them that may not be the natural structure that's existed in this community for a long time. Secondly, just under half of the respondents indicate that child care issues are a significant impact on their ability to participate fully in the workforce in Manitowoc County. You know, I think when we started, our hope was there was this pot of gold of people that aren't working because of childcare. And what we found is that's not really the case. There are a few, there are some that I think we can bring back into the workforce, but we've got a lot of people that are not participating at a level they could participate at, either in terms of their skill set, or in terms of the hours they're working, or in terms of the jobs they're working. And so the challenge there is going to be, how do we create a structure to elevate them in the workforce? Under half tell us they feel their childcare needs are being well addressed in the community. Yet almost an equal amount, when we ask them to rate their satisfaction with childcare in Manitowoc County, give it one of the bottom 3 ratings on the 10-point scale. That one was kind of surprising, because you would think those two are in alignment. If my needs are being met, I should be happy. That's not the case. And so what we're doing is we're kind of putting bandages on AWAs. And we're getting through it, we're getting by, but we're not meeting the needs that are truly out there. And that's part of this next step. The good news is employers can be an active part in this process. We see in the study that employees value their employer being engaged, and engagement can be anything from simply understanding their situation to providing, as Jamie was talking about, some type of benefit tied to childcare. But as you'll see, even recognition from the employer that they understand that childcare is a part of that employee's life is important. And then finally, we've done things over the years around employer net promoter score. That's, if you're a business person, net promoter score is kind of that magic measure of loyalty. It's the one question that people kind of look for. When we did our first one with the chamber, we had a 5, I think, was our first score. Now, if you took a company like Harley Davidson, their net promoter score is usually in the 80s. We don't see that with employer satisfaction. We usually see something in the 5 to 9% range. But we had some groups in our first study that were actually negative. So an 11, which is what we had in this most recent study, is actually an improvement from a few years back. It says we're getting better. What was interesting is that 28% of our respondents indicated they were likely to change employers in the next 2 years. That's a lot of turnover. And if I'm an employer struggling to hold my workforce together, looking at this and saying, well, I'm going to have a third of them possibly turn over in the next 2 years is a challenge. So the good news is, I think there's things we found in the study that can help address that, but everybody's going to have to work together to make it happen. Okay, you can actually go 2 slides. We'll go into the details. So just a quick review of who we talked to. as you would understand, when we're talking to families, we're going to have a younger respondent group. We were primarily under 45 years of age, but we did have some family households in that 45, 54 age group, and we had secondary care providers older than that. It was heavily female. If we look at the families, we had a mix of children in different age segments, infants and toddlers, preschool, school age, teenagers. We had 15% that have special needs. And I was kind of surprised when we cut that group in the data. They actually seem to be stronger and in some cases more satisfied than the families that didn't have children with special needs. Now, it may be a situation of focal point, and that those households that have special needs know that those needs are going to take priority. But it was interesting when we looked at how often they provide childcare for others than their own. It varied, but more than 3 times per week was fairly common. And if they provide childcare for children other than their own, we had mostly special occasions, but we did have basically a little better than half the sample provide some regular. So we had a mix of kind of usage, mostly homeowners, mostly Caucasian respondents. Interestingly enough, when you cut the data, even though we're not really heavy ethnically, we find that Hispanic families are a little bit more challenged in finding care, which is kind of interesting because I think a lot of us think of the Hispanics as being more family oriented, and you would think that would fit this model we seem to have here better. That's not the case according to the data. And we had a mix of how long people have lived in the area. Now, if you're born and raised here and someone who's done research here for a long time, this is actually refreshing to see how many new people we have in the community. A lot of times when I do community studies and we look at the mean for how long people live here, 35, 38 years, pretty common. So we really reached some new people in the community. We got a fresh perspective. We've got some good information. So let's talk a little bit about what we found. So if we started with an open-ended question, we said, what do you see as the biggest issue concerning childcare and your family? And we just let them respond. The word cloud, if you haven't been familiar with those, a word cloud takes all of that open commentary and it looks at how often certain words come up. Obviously, the biggest word is childcare. But you see words like daycare, fine, cost, school. When you break those out, the issues we have around affordability aren't terribly unusual. It's availability, it's affordability, it's access, and it's trust. If you look at almost all the national studies, those are the items. So we're not any different, but we are unique. So the rest of this, I'm going to move over so my older eyes can reference some of this, and hopefully you guys can see them as well. But if you look at how much impact childcare has on the household, the top right there is the distribution. We had a mean of 6.3, so it's slightly above average. But if you look at the ends, we have a small group that says there was virtually no impact, just over a quarter in the bottom 3 ratings. But we have 46% in the top 3 ratings. So almost half the respondents indicate childcare is having a significant impact on their family. What's happening? Here's some common things. 61% had to use vacation or sick days to address childcare needs. 55% have missed work due to childcare issues. 52% have turned down additional hours or options at work because of childcare needs. Now, again, when you start looking at that across numbers of people in this community, numbers of employers, this is a very significant hit. And remember, it's kind of a double-edged sword. Not only are they burning up sick days and vacation days to take care of children, but remember, our role as an employer is to give those people days to recharge. They're not using those days to recharge. They're using those days to survive. And as you're going to see as we get into some of the job experience, they're stressed at home, they're stressed at work, and we aren't giving them a lot of respite opportunities in the process. We put some statements together to look at how important certain things are. 10-point rating scale, the highest mean score was having on-site childcare available would make an employer more attractive to me. 8.9 for a mean, with 600 plus people answering. That is enormous. Second item, a job that offered some level of support for childcare would be more attractive to me than others. So if you don't have it on site, how can you support it? Can make a significant difference. Childcare costs make it challenging for me to use options outside of my family and friends. 8.1. The cost of childcare makes it less attractive for me to work to my full potential. 7.7. So those top 4 items are very strong. If you go to the bottom, you think, okay, well, we must have done good on something. The bottom is actually kind of the negative things. Babysitters are readily available and I have short-term or sudden needs. Only a 3.6 rating on that 10-point scale. So they're saying they're not available to them. Our family has no issues related to childcare or children in this area. 4.2, well below average. So we've got a lot of things to work with. Now, the good news is we can cut all of this and we can look at the groups it affects. We can tie it to the way they're working, and we can help create programs and packages to help address it. So this is kind of setting up a foundation for us to take some of the next steps. Next slide. Okay, so here's how they're addressing their childcare. Upper left, what are you using? They can check multiple. Other family or relatives, spouse or significant other, top response. And then we see a mix of other items. If you answered more than one, what is the primary? Other family and relatives, spouse and significant other, and it drops way off after that. So again, it's wonderful that we've got that safety net in this community, but how do we attract young, new people into this community who aren't going to have a safety net like that? How can we make that work for them? And, you know, the challenge is we've got so many good things happening here with the downtown, with the growth in industry in this community, with a lot of the advancements. We're going to need new young people in this community. If they come here and decide to start a family and can't find the infrastructure to care for that family, we're not going to hold on. And we're going to be a feeder to the surrounding community. We know we're already a bit of a feeder. It's gotten better in recent years, but it's a pretty significant issue. When are they having problems? Most of it's fairly traditional. It's early mornings and before school. It's daytime and it's after school. Those are the key areas. We do have some needs around evenings, a little bit around overnight and others. And those are going to tie more to part-time and shift work type environments. This is what we were talking about in the summary. On the left side, how well is that care of your child care needs being met? We're doing pretty well. 6.8 mean, above average, 49% top 3 boxes, only 15% in the bottom. They're averaging about 2.5 days per week without site parties. Seems pretty solid, but when we say on a scale from 1 to 10, with 1 being not at all satisfied, 10 being totally satisfied, how satisfied are you with the overall childcare options available in the county? Wow. total shift. So we're getting by, we're meeting needs, not making a lot of people happy. So it tells us we can do things and we can get better. Next slide. So here is our employee group and what they look like. 76% of the respondents were full-time employed, 24% part. Now, interestingly, and this is a bit of a slip up on my side, but it actually generated something good. There was a follow-up question that asked, what percent of the time are you working more than 42 hours a week? And I meant that to be for full-time workers. It didn't make it in the skip logic in my questionnaire, and part-time people answered it. And amazingly, the part-time response was higher than the full-time response. So what we've got are people working multiple part-time jobs and working more than 42 hours a week in doing them. So, you know, again, you talk about stress factors. That's a whole nother stress factor. If you're working part-time, do they work more than one job? 21% said yes. Would they prefer a single position? Most would. We found the people that are working outside of Manitowoc County would prefer to work inside of Manitowoc County. That's a positive. We can work on that. When we look at when they're working, it's pretty traditional shift, first shift kind of environment with the respondents. And how many days per week are you working? 4.7, basically full-time. And that is both the full and the part-time people. So they're working 5 days a week for the most part, even if they're working part-time. People are working from home, about 27%. If you look at being a heavily manufactured community, you're not working a CNC machine from your house. So we would expect that to be lower, but it is interesting when we find that people that are working from home do about half of their work from home. And almost 60% of them say that childcare was a big factor in doing that. That's important because it tells us if the possibility exists, it's a good possible way to bring more people into the workforce. If the structure of your employment or your employer's work allows for it. And that can certainly be something to help us address some of the future needs. If you read some of the stuff, there was stuff in the Wall Street Journal today that America is lagging behind Japan, and I think Europe, in terms of return to office. Japan and Europe are returning to office. The US is slower in that process. Next slide. This is a little bit more on kind of what we're seeing there. Are you seeking employment now, either new, additional, or change? 15% were. So we've got kind of a natural churn in the market of about 15%. Not terrible, but it's interesting when you cut that group, they're young, they have children. So that group is more likely to be seeking other employment. This is our net promoter calculation to get to the 11 we talked about in the summary. The one on the upper right is kind of interesting. This is everyone in the study and how likely are they to change employers in the next 2 years. 28% likely or very likely. Again, that's that 30% turn. And again, when you cut those numbers, under 35 with children, especially infants and toddlers. The infants and toddlers group looks to be a real target point. I think you've got young families that are really struggling to get a foundation for those younger children. We ask about satisfaction of different components of their employment experience. Actually, pretty solid. The top 3 box means how many people gave it either a 7 or an 8, 9, or a 10 on the 10-point scale. Travel times to work were good. Schedule solid. Flexibility decent. Facilities and environments, really everything above average. The lower items aren't unusual items. Wages, benefits, opportunities to advance. Those were the three lower items. So, you know, we're not red flagging anything here. This isn't saying that we've got families who just nothing's working. Things are working, they're getting things done. This is telling us there's ways we can help them get it done better, get it done more efficiently. They've worked with their current employer a very broad mix of years. I was very surprised at this until I looked at, we have more newer people in the community. Our respondent base, healthcare, manufacturing, education. It was interesting, banking, government, and education were the most highly satisfied and had the fewest issues with childcare. Next slide. So this is the non-working group. We had 13% who currently weren't employed. Of that group, about 60% said they could work, or at least are able to work. Another quarter say they possibly could. What are the barriers in terms of them currently not working? Childcare is the biggest single issue, more than 3 times anything else on the list. This was unaided, it was not a checkoff list, and this question was very early in the process. It was before we got into all the childcare issues. So we didn't kind of paint them by talking about childcare. We asked this early in the survey. So another flag that said, boy, if we can do something about it. Another piece of this is just under half are receiving some type of financial assistance. We've all heard, you know, about the issues of overcoming what that public benefit is worth in terms of hourly wage or salary that has to be overcome in order to get people back in the workforce. That is part of the factor here. But the good news is a good chunk of this group, if the right situation were available, would come back into the workforce. 62% of the top 3 boxes, a mean score of 7.6, well above average. So it's not a pot of gold. It's not an enormous group of people, but there are people we can bring from out of the workforce into the workforce if we can create the right situation for them. Would their skills allow them to work from home? About half say that it would. The people that are not working in Manitowoc County now would like to work in Manitowoc County, so that's another group we can look at. So we've got kind of these little buckets of people that we can segment in the information and try to put plans and ideas together on how do we address them, how do we attract them, how do we get them engaged. And we have a lot of the foundational information here. Doesn't mean we have a solution, because solutions are going to take some time, especially when cost is a significant driver. You know, one of the things I took on the high level out of this is the families are telling us it's too expensive to go outside. And we know from the childcare workforce, they're not making enough money to survive in many cases. And that gap is not going to get smaller. So we're going to have to do something here as a community or as an employer group to step in and try and figure out how do we fix that financial piece in the middle to make this line a little bit better. Next slide. So when my wife says I'm the weirdest man she ever met, because a fun evening for me is sitting watching television and running through data on my computer. Here's some things that kind of jump out. And multiple times, there is such a strong and direct connection between childcare and workforce. It's just one issue. 18 to 34-year-olds showed the biggest impact. 18 to 24-year-olds especially strong beyond that. And I think it makes sense. They're probably new to the parenthood environment. They're not quite as experienced to be able to handle it. Again, those with infants and toddlers, much stronger issues than some of the other groups. Part-time employment ties to stronger issues overall and also lower employer satisfaction. And again, those kind of all roll together. It's that younger group. Respondents that told us they had high impact from childcare worked 8% more hours than those who said they have low impact. So again, that extra level of stress by working more. Employment satisfaction ties to childcare impact, and those with low satisfaction are significantly more likely to change employers in the next 2 years. The moderate group shows much stronger use of family and relatives in their care. They show stronger use also, though, of daycare and before and after school programs. So that moderate impact group is trying to find ways to work in the system, and to a certain extent, it's working. I mentioned Hispanic respondents had a higher level of impact. Respondents with children but currently not working and are receiving government assistance are stronger, interestingly enough, in the 35 to 54-year-old group. Respondents under 45 and not working show a higher likelihood to return to work in the future if the right situation were to present itself. Respondents with incomes of under $50,000 showed more issue with childcare and a higher level of work issues tied to childcare. They also showed a higher level of resistance to the cost of childcare. And 18 to 24-year-olds were more likely to be seeking employment. Currently, the under 35 group was more likely to change in the next 2 years. And that's just another way of saying those family units are looking for better options. And I think that's the majority of things. Next slide, talking just a little bit about what happens next. And obviously this is less my involvement than the groups, but we'd like to talk more to the community in this process. Certainly like to talk a little bit here this evening about it. But we'd like to do some discussions with some of the target groups to get behind some of the things that are happening with these issues. What are they experiencing? What solutions might be available? And that's the families, the secondary caregivers, and the child care providers and organizations. And that can help us set some targets and goals for a plan for the future. We also need to engage the employers. We need to talk to them about the same information. We need to have discussions with them to determine their interest and consideration of future programs, because they can be a partner in this. This is a tool for an employer to differentiate themselves. If they can grab onto this and use it, there is a clear opportunity here. And the goal being to identify specific ways that employers can more deeply engage in child care workers. I think that's all I have. Questions, discussion, comments?
Just want to clarify something in your survey. These are families who are getting child care is not being provided by families and relatives. These are also families who are getting child care from child care providers.
Yep. The sample is basically families. If you have children under 18 at home, you were eligible for this.
Okay, and it doesn't matter where the child care is
No.
provided. Okay, initially I thought this was family child care being provided by families and secondary. Okay.
No. What we found is
Okay.
that's the primary mechanism to get that care.
Okay,
Yep.
that's where I may have been confused because
Yeah.
I heard that saying that the primary mechanism.
Yeah, and I mean, when you dig into the data, the cost issue is significant, and quite honestly, they don't know where to go. You look in some of the verbatims, and they've tried, they're on the lists, they're just not finding opportunities that they can use. So the family is becoming the safety net, and spouse and significant others are doing that.
Yeah, and that's an interesting phenomenon, and one, just thank you. This is great data. It reinforces a lot of what I think like you said earlier, a lot of our gut was telling us already, but it's just great to see the numbers and that phenomenon that you talk about of this being that family is the primary care, and that you referenced earlier, that PTO double-edged sword, like they're using these days, so they're not getting rejuvenated and they're doing it in childcare. That layers onto that idea of using family as well. Families in an ideal world could wrap themselves around and take care of our own and have a parent, grandparent, aunt, uncle who's at home in a caregiving spirit and taking care of kids. But in our economy, the likelihood of those caregivers also having to work on the off schedule of that primary care provider is very good. So now you have multiple generations of that stress of never getting time. You have grandparents, and very anecdotally, we had a grandfather in Hawaii a few days ago saying, I'm just here to ask what it would cost for 2 days of care. My wife and I were looking forward to retirement. We now have a 3-year-old in our lives. What would it look like to bring him in on Tuesday and Thursday? So this is a very real mental health issue. Nobody's getting a break.
Yeah. Well, and I just saw in the news earlier this week, one of the biggest trends in the US right now are parents moving back home with their children. You know, we've been saying all the time about the children moving back home with their parents. Well, turn around is fair play apparently, and that's a significant trend as well. And we didn't even touch upon adult care in this, because you have families that are dealing with both.
I will make a comment on the portion of the Hispanic families also needing childcare. One, because I come from a culture where family is everything and family takes care of family. And also I'm an immigrant and I work with Hispanic clients. And I think, of course, anyway, not that I'm an expert, but my experience of what I have dealt with is these Hispanic individuals are most likely immigrants and they have nobody. I've worked with clients who were in the hospital giving birth by themselves while their husband was at home with the other children. No mother, no cousin, no, mother-in-law or nothing to, care for them. So something to also keep in mind that, well, culturally, they are very family oriented. If they moved here and they have no one, then that's probably what's increasing their need for childcare.
Well, and I think we would have liked to have had a deeper ethnic mix, because we know there are other populations in the community. And I think we still may have to consider that. We did not have time to make that happen in this initial study. But I think, we can look at Hispanic Hmong populations and look at how do we connect some of this there as well. And I think you make a very good point. All this is a starting point. There's a lot here. It all fits together. That's what's nice. A lot of time I'll get studies where there's just some things that are outliers. This didn't seem to be one of those. Everything really fits. It connects. It's logical. The data supports it no matter which way you cut it. We've got a good foundation to work forward. Thank you. Jamie, any
Maybe a question for the group that's working on this team, but are there any employers that are currently doing this successfully? Any positive models out there that have in-home
They're
daycare?
dipping their toes. There is some grant funding that went along with the Stream Up grant called Partner Up. There are a couple local employers that are doing that. So they're receiving some grant funds to pay that. And tell me if I'm doing this, saying this right, because I know you're the childcare provider. Where they're getting grant money to reimburse the employer portion of that. They're paying a higher rate to the childcare center because the point is to allow the childcare provider to provide better wages for workers. They're making $12 an hour. That's a tough recruit to get people into that field, and that is absolutely necessary. We have childcare centers that aren't operating at capacity. Hospitals are closed. Those are kids that can't go to childcare. So we need that. We need in-home providers, family care, there's an opportunity there. So, John and I are in a lot of rooms with our economic development colleagues and we're like, this isn't what we thought we'd be talking about, but it is 100% a workforce issue. It's not, it is about education and educational components and raising our children, the next generation of workforce, but it is 100% about getting people into the workforce because everybody is short work.
I think too, and I'm looking forward to talking to some employer groups because I think there's some very basic, inexpensive things that employers could do to raise the ship a little bit. Just talking to employees with families and recognizing their situation and trying to be as flexible as they can and communicating better, I think would be a great starting point. We certainly understand you can't start throwing an extra $5, $6 an hour on for childcare. Yet some of the stuff we've seen says that's what it's probably going to take. So, I think we have to work as a community and work as a group and say, okay, what can we do here to shore up some of the edges? And I think part of it is communication. It's making sure everybody knows where everything is. Having employers try to communicate that they understand the need of the situation, and then all of us trying to figure out what can we do to do something different. So that's what it's going to take. I mean, this is a model of same old, and families being resilient, finding a way to get it done.
Mention the model, the childcare model, it's on the backs of the parent to pay fees, and it's not affordable. And it's not affordable with workers making low wages and childcare providers who own childcare centers are not, driving the Rolls Royce and living in the mansion on the hill. So the margins in childcare are so narrow, they barely get by. So, that just tells you that it's broken. Just that whole payment system and the whole fee system, we need to find a better way.
In some cases, cheaper to not work.
Right.
Well, and that's it.
For that portion of your life while you're, and so people are choosing to do that. For some, it means leaving a career and then having to start over once their children, making a choice. And that's what I was bringing.
Yeah, you can see some of that in the part-time and especially the rotating shift people that are working like the weekend shifts. They're working the, 3-day, 10 hours, get paid for 40, things like that. But that only fills in so much too, because it doesn't cover every situation or need.
Dean mentioned that this is an opportunity for employers, this is to be a differentiator. And I talk a lot about, we're all fighting for a lot of the same people, and it's a way to be the employer of choice because you're offering something that demographic needs.
So one more thing, and I don't know that this was part of the survey, but having your child in childcare, you also gotta account for your kid is also gonna be sick. And because they're around other children. And I understand this is just an anecdote, but one of my employees, her husband lost his job, because he stayed home with the kid when he was sick. So part of the discussion also with employers need to be, I don't know the level of flexibility that an employer can offer. You need to stay home with your sick child so the other children don't get sick, right? So that also needs to be part of the conversation.
Good point.
I think that's important in our life. I'm a financial institution, so the front line, but there are quite a few people that, and I have found if they have a sick child, if your child's home, you're not working. And I've taken the approach of do what you can, be there for your child, and they almost all get their critical things done that day. And they're working at a different capacity. I just, the people it works for just take understanding and remembering what it's like to be a parent, because as we get older, we forget it's our kids, but it's amazing what people will do and how they'll appreciate that as well. And they will get their jobs done, again, for the jobs that it works for, right?
I do think as part of our next steps, having really good conversations between employers and childcare providers, because I think there's a lot we can do in our business models if we can count on our employers being more flexible with some of their, like, already this summer, we're looking at only offering school age care Monday through Thursday, staffing issue.
Yeah.
How is that going to affect people? work with our local employers to ensure that these people aren't gonna lose their jobs because every other Friday they have, how do we just start having that conversation, which is a win for the employers, they get to go back to their employees and say, we hear you, we understand, we're gonna make this work. Now, no, you don't get to work with 8 hours less a week, but how can we figure this out in a different way? But 12-hour days, we have to be open to 6 to 6. That's a tough thing to staff. And that's really hard with overtime and breaks and licensing with ratios. And is there a way we can work with employers to say, hey, we're open 7 to 5:30? So I just think there's a lot of opportunity there, up to and including the handle help for the family.
Nothing's off the table. We've had conversations about other childcare centers coming in, employer housed, nothing's off the table. I have a long list on my whiteboard of potential locations that could be childcare centers if we had an operator. But our goal really right now is to get our current childcare providers at capacity, which means more childcare workers, to really work with our employers and talk to them about some meaningful employee benefits that could really be a game changer for them and for.
Thank you all. I see most of you have copies of the document. There'll probably be more information released as time goes on. We're kind of spoon feeding as we.
This is our first big
Yep.
public conversation. There'll be more, I'm sure. So if you want to stay in touch or get on a list, or as we start looking at maybe some focus groups and things, there is a sign up sheet. Phone number. Sure that.
Thank you, everyone.
Thank you very much.